I want to begin right out the gate by saying that the individual risk for coronavirus in Idaho is still low. However, national and international situation is rapidly evolving, and we do expect confirmed cases in Idaho at some point. With reported cases now in neighboring states, I felt it was time to elevate this issue and share some information about what Idaho has been doing and will continue to do to prepare us for a potential outbreak. We are all learning more about the coronavirus as each day passes. Most of us who are in good health do not have to worry about getting sick. From what we know about it, the 2019 novel coronavirus should not be a concern for parents of healthy children. Dr. Hahn will also talk about that in a bit. But for our older population and those with compromised health conditions, coronavirus, just like the common flu, could be very harmful or deadly, especially since it's occurring during the flu season. That is why we must all do our part to prevent the spread of this disease and all respiratory illnesses to preserve capacity. We must do what we can to keep those vulnerable folks safe. Just this morning, we unveiled a new online resource for Idahoans to access up-to-date information on the situation in Idaho. The website is coronavirus.idaho.gov. Updates are also being shared on a new Twitter account. It is important that Idahoans stay informed and seek information from these official sources. Idaho's public health officials have been working for months with the Centers for Disease Control and Prevention and other states to prepare Idaho for the 2019 novel coronavirus. They are in regular communication with Idaho's local public health districts and healthcare providers around the state to make sure they know what to look for and that they are prepared to respond if someone is sick or has been exposed. To support our public health agencies in Idaho, I want to share that I just created a new coronavirus working group to help in our preparation efforts. In fact, we met for the first time before this press conference. Members of the group include Director Dave Jepson, Idaho Department of Health and Welfare, our chairman; Brian Whitlock, President, the Idaho Hospital Association; Carol Morley, Director of the North Central Public Health District. She joined us on the phone. Brad Ritchie, Director of the Idaho Office of Emergency Management; Dr. Carolyn Bridges, retired CDC public health physician; Dr. Dave Pate, retired physician and hospital CEO; Superintendent of Public Instruction Sherry Ibarra. As our public health officials continue to do the work they were trained to do, my new working group ensures we're keeping the lines of communication open and enhancing our coordination efforts on a number of fronts to best serve the public. I am committed to providing timely communications with the public on the status of coronavirus and our preparation efforts in Idaho. In addition, I directed my budget office to work with the legislators to make funds available to aid in response efforts if we need to do that. Those discussions are actively happening now. The White House and Trump administration have been great to work with on issue, and we are certain they are fully committed to making funds available to Idaho to cover the costs of responding to an outbreak if we experience that. In the meantime, I encourage Idahoans to do their part to keep vulnerable populations safe from this disease by preventing the spread. Wash your hands. Use etiquette by covering your cough and sneezes. If you are sick, stay home. I want to thank the members of the news media for being here today. You are an important part of ensuring that the public receives accurate information on this important issue, and I appreciate your public service. I want to thank the healthcare workers and public health officials for their public service as well.